the opportunity to transform the lives of millions of people with chronic conditions in the region is a huge opportunity. I see a future where healthcare is accessible, it's easy, and it's convenient, and as convenient as ordering lunch from Talabat. No one cares how much money you have in the bank. No one cares what assets you own. People will always remember how you made them feel.
Welcome to the Change Officer, Khaldoon.
Thank you for having me, Vuk.
Man, it's really a pleasure having you. Thanks for driving all the way from Abu Dhabi.
Anytime.
I remember the days 2 years ago when I was driving to Abu Dhabi like 3 times a week. Man,
yeah. I used to actually commute on a daily basis.
For the meeting that's going to take 45 minutes of your life and you're not going to do anything. Yeah. And then you lose 4 hours of your day.
Well, I listen to a lot of podcasts.
Yeah.
So you're in the right business.
Exactly. There is really a lot of things that we could talk about. Your life journey had a lot of different episodes, all the way back from growing up in Palestine and then Canada, school, Nokia, VC, Careem. But I wanted to start with unpacking and talking more about creating opportunities. And the episode of your life when you went to California, I'm not sure what was the name of the conference, when you actually met Careem guys.
Yeah.
And that was, I'd say, probably a life-changing event. I mean, we are making decisions all throughout our life, and you can go right or left. You picked decision to move to Dubai. But let's talk more about that opportunity and how that actually happened.
So I was in San Francisco. I heard about this event at Stanford University, where the co-founder of Careem, Magnus Olson, and the head of product back then, Wael Nafi, were attending more like an event. It's not a conference really. It's an event to introduce Careem and attract product managers as well as engineers. I am not an engineer, or I'm not a software engineer, but I'm definitely a product manager. And I decided to show up. I decided to learn more about this company. I ended up speaking with Magnus after the event. And
how big was that event?
It was quite big. I think 200 people showed up. Yeah, the room was full. Lots of people from all walks of life, different backgrounds, different nationalities showed up, and they asked questions. And I think all of us were extremely curious about this unicorn that came out of the Middle East.
At the time,
it was a unicorn, a unicamel. They like to call it the unicamel. So we were all curious. We wanted to learn more. And I think the guys did a great job talking about the opportunity in the Middle East, talking about the company, and the role that a product manager or an engineer would play at this company. They definitely sold the dream to a lot of us in the room. I'm actually not sure how many people moved from San Francisco to Careem after that event, but I was definitely one of them.
But you went for it. I mean, you spoke to them.
I did.
Out of 200 people.
I did.
And it's, the law of attraction that people, some either believe in or not. But I explain that as a very simple, law of action and reaction. You created that opportunity, right? You approached them over there, right?
Yeah. And they wanted to be there, right? So it worked on both sides, I guess.
Right.
Yeah.
So you moved to Dubai after that, and you started.
And I moved to Dubai.
I moved
to Dubai after a few months.
Would you say that the whole Careem episode was a game changer for you?
Absolutely, no doubt.
What were the kind of the key takeaways from that?
So moving back to the region, and working for a startup. Careem back then was a startup that occupied half of a floor in a tower in Dubai. Of course, we had regional offices, but Dubai, the office was small. And for me, that was a leap of faith. I didn't know anyone at Careem. I've heard of Magnus. I've heard of Poddster. I had met Magnus once, but I was sold on the dream. And I like the co-founders a lot. I've heard them, I went, did my research on YouTube, heard them speak. And I had the strong feeling that this is a team that I could work with and a vision that I could be a part of. Careem was on a mission to simplify the lives of millions of people in the region. And I believed I could be a part of that mission.
Amazing. We're going to talk more about the lessons that you learned in Careem and how are you possibly implementing them today. I want to talk about how you created another opportunity in your life. Alma Health.
Yeah.
It's the startup that you founded that is now growing. You recently raised some nice funds. Tell us more about Alma.
Yeah.
Introduce us to the story of Alma.
Let me tell you how it all started.
Tell me.
So while working for Careem, I had 2 herniated discs. Like many people, I worked a lot and I exercised a lot. I thought I'm on the right path. I'm a healthy guy. Everything's going well. Next thing you know, I'm suffering from pain in my neck and in my back, and I have 2 herniated discs. I took that matter very seriously. Started seeing a doctor, was on medication, started doing physiotherapy, and I realized how inconvenient the healthcare system is. And I'm a patient with a chronic condition, herniated disc, right? Imagine what it's like for somebody that has diabetes or somebody that has hypertension. So a herniated disc is something you could manage. Luckily, I'm okay now. I'm not on medication. I'm not doing physiotherapy. But somebody with diabetes or hypertension, they have to manage that illness for the rest of their lives. So I asked myself this question: if it's so inconvenient for someone like me with a herniated disc, I wonder what it's like for someone with diabetes or hypertension, somebody that has to live with this chronic condition for the rest of their lives. And this is where I started thinking about starting a company in healthcare, a company that focuses on the patient and transforming the overall patient experience. So this is the genesis of the idea. I live the pain. I come from a background of technology, consumer technology, and I wanted to combine these two worlds together. I did a lot of research. I spoke with a lot of people with chronic conditions. I spoke with doctors, with pharmacists, and I immediately realized that there's an opportunity to transform the lives of millions of people with chronic conditions. And this is what we do today at Alma Health.
All right.
So at Alma Health, we offer people a virtual doctor consultation through our app. The doctor can renew a prescription for a patient with a chronic condition or issue a new prescription. That goes to our cloud pharmacy, where we fulfill the prescription from the patient's home. There's no need for them to come to the pharmacy. We fulfill it, we deliver it within 24 hours. So we can do all of those services while the patient is at home from the comfort of their couch.
All right. Sounds like when you say prescription, so sounds like there are some regulations around that.
Absolutely.
Like, were there any obstacles over there? Like, how can you have a doctor prescribe a medication just via like webcam?
Absolutely.
Is that something that's what is in place, or you kind of created it?
So I don't think this business would have existed 3 years ago. I think
would it be possible?
It would not be possible. I don't think so. I think the pandemic accelerated the adoption curve for digital healthcare in our region. It did all over the world, but especially in our region. Governments like the UAE government, the Department of Health in Abu Dhabi, the Department of Health in Dubai, the government of Saudi, the Ministry of Health in Saudi, really accelerated regulation around digital healthcare, whether it's regulation around telemedicine, regulation around pharmacy delivery, prescription delivery. So I don't think this business would have been possible before the pandemic. And I think the pandemic accelerated the adoption rate. So you're right. We operate in a business that is heavily regulated. We are a healthcare company as much as we are a technology company. We hold the healthcare licenses. We hire the doctors, the pharmacists. So yes, we operate in a highly regulated environment.
Interesting. Now going back to some of the Careem lessons and episodes, you are building your company on your own now. You were a part of an amazing story that everyone witnessed over the previous couple of years, and they grew from 1 to 1 million very rapidly. And I'm sure it was really exciting and interesting to be, firsthand to experience all of that, and you could learn a lot from growing a company like that. Now, when you're growing your own company, what are some of the lessons that you learned with Careem that you're trying to incorporate now in your company?
Oof, that's a good question. I think there's a lot of lessons to be learned. For me, the most important lesson is team, having a very strong team. I'm very fortunate to have an excellent co-founder, Tariq Siksik, who looks after product and technology at Alma Health. We have a number of key leaders that we hired recently. Ihab, who's looking after product development, our engineers, the tech infrastructure. We have Hiba, who's looking after brand and marketing. So it's all about building the right team early on.
How do you do that? I mean, I was expecting that answer, honestly.
Yeah.
But how do you do it? Like, how do you build a strong team?
I think you have to spend time with yourself as a co-founder of a company and really reflect on your strengths and weaknesses. We all have weaknesses, and you really want to bring a team that complements each other. You want a team that could work together like a beehive, right? Each has their expertise, each brings their knowledge, and they all work together in a synchronized manner. So this is exactly what I did. I looked at myself, my strengths, my weaknesses, and based on that, I started hiring the leadership team. And I'm very lucky to have a team that is building a company that is consistently growing, simplifying the lives of thousands of people in Abu Dhabi today, and raised capital from top-tier investors.
There is a big difference with hiring a team before and after raising funds.
Correct.
Right. And let's say that, both are coming with some difficulties.
Sure.
How do you gather the right team before you raise funds? How do you source them? How do you find them? How did you work around that? Yeah. How big was your team before raising funds?
So we were 3 people. And how I hired them, it's about the vision. People have to buy into your vision. People have to trust you as a leader. And people have to understand what are your strengths as well and what are your weaknesses. So you as a co-founder, you have to understand your strengths and you have to understand your weaknesses. And so does your team as well. You want to bring in a co-founder that doesn't have the skill set that you have. And if that co-founder believes in your vision, believes in your leadership, believes in the amount of hard work that you're going to bring to the table, you don't have to pay them.
Did you look for them in your close circles or you went...
Close circles.
Close circles.
Absolutely. That team is probably the most important thing you could do for the company. Because at that point, you're just an idea. Everyone has brilliant ideas.
Absolutely.
It's all about the execution, right? So you want to have, you want to surround yourself by people that buy into the vision and have the expertise or the skill set that you don't have. And together, the output is masterful execution against the idea that you have with very limited resources.
Wow. How did you exactly, that's where I'm aiming, going for now. How did you mapped out your steps from having an idea, going for it, hiring the team, raising funds? You had a job before you that you quit.
Yeah.
And then you went all in.
Yeah.
But the idea was probably cooking while you still had a job. How
Correct.
did you decide to go for it, and how did you what was the timeline of activities that you were kind of putting together to prepare for something like that? Yeah. Did you work on the idea and then say, okay, let's try to find partners, raise some funds, and then quit, or you quit and then went all in for it?
Yeah. So there's never the right time. I don't think there's ever a right time to quit your job and do it full force. You have to follow your gut, and I'm a person that follows his gut. I looked around, and a lot of people with chronic conditions, because of the pandemic, have stopped going to the hospital. I spoke with mentors. I spoke with people within my network, friends, family, doctors, pharmacists. I spoke to a lot of people, and I kept hearing the same thing over and over again. People with a chronic condition don't want to go into a brick and mortar hospital. They're scared because of the pandemic. And people with a chronic condition are the most exposed to at high risk of COVID. So for me, that was a massive opportunity. I thought that this is the right time to quit my job.
Now or never.
Exactly. Now or never. Quit my job in the middle of a pandemic when people are getting laid off. Quit my job and start this company. But it's been cooking in my mind for a long time. Again, it's about surrounding yourself with the right people. So that's why you probably hear this answer over and over again. It's the team. I spoke with the people that were working with me on this idea. We had built an MVP. We had some initial traction. So we knew that there's a market for our product. And with the pandemic happening, with people's behavior changing towards brick and mortar healthcare providers,
it just fueled it.
It just felt right. It just felt right.
Yeah, I'm curious to understand the process that you went through and the plan that you put in place when you started with this. On the day one, you quit, you got together, you started working on the MVP. You had a certain runway in front of you. The point until which you will be able to self-fund it, but at a certain point you had to raise funds.
Correct.
How long was that runway, and what was your plan with raising funds?
Yeah.
Or not?
Yeah. So the plan from the get-go was to raise capital. And we wanted to raise capital from VCs because we want to have a massive impact on the lives of millions of people. And we want to do that quickly. And that requires scale. That requires smart capital and a lot of capital. So the plan from the get-go was to raise capital for Alma Health.
Mm-hmm. I want to understand, how did you decide to go for this niche group of chronic condition patients? Why that market?
Yeah. Unfortunately, in our region, chronic conditions are not niche. The region suffers from high prevalence rates of chronic conditions, diabetes, hypertension, obesity, heart diseases. Those are very common. There's millions of people that live with those chronic conditions. And unfortunately, they frequently depend on a healthcare system that was designed 100 years ago. Mm-hmm. We believe at Alma Health that the experience that a person with a chronic condition receives is inconvenient. We believe that at least 90% of the services offered to a person with a chronic condition can be offered outside of a brick and mortar healthcare provider, whether it's a hospital or a clinic or a laboratory. And we're making that future a reality today in the UAE.
Tell me more about those services that could be or are not being provided remotely, and what are the types of treatments they're currently receiving in brick and mortar that should go online.
Yeah.
For someone who is not coming from the industry at all, just to understand.
Absolutely. So a person with a chronic condition is not looking for a diagnosis. Usually
they already have it.
They know they have diabetes. They know they have hypertension, and they're looking for ways to manage the condition. And at Alma Health, we offer a person with a chronic condition a virtual doctor consultation through our app. So somebody from the comfort of their home could pick up their phone, talk to an Alma Health GP to help that person manage their condition. If they want to renew a prescription, the GP can renew that prescription automatically without having them come to a clinic. And we can fulfill and deliver the prescription to the patient's home quite fast. And this is a step change in the healthcare experience that a person with a chronic condition receives in Abu Dhabi.
And what would traditionally happen? They would have to sit in the car, drive to the hospital just to get the check.
Absolutely. So for a person with a chronic condition, their life literally depends on the medication that they take. And unlike somebody with an acute pain, for example, a headache or an abdominal pain, you can't just walk into a pharmacy and take your medication. This is prescribed medication. You need to get insurance approvals. A doctor needs to renew your prescription. So the person with a chronic condition who wants their medication, they just ran out of medication, they have to go see a GP. They have to drive to the hospital. They have to park their car. They have to wait in line to see a doctor.
All that takes hours.
Exactly. It takes hours. And sometimes you can't even get an appointment with a GP on time. You have to wait for weeks to see a GP just to renew your prescription. So you're not looking for a diagnosis. You're just looking for a way to access your medication again. And we think at Alma Health, that is not right. At Alma Health, from home, you could pick up your phone through the Alma Health app, see a GP that could renew your prescription. Because we are a healthcare company, the GP can renew the prescription with the insurance, can send the prescription to our pharmacy. The pharmacy can also get the insurance approvals, fulfill your medication, pack it, and deliver it right to your doorstep. So we've taken a completely offline experience online. This is live in Abu Dhabi, and we've heard from many patients that this has transformed their lives. We've offered our service to thousands of people in Abu Dhabi, and we're very proud to contribute, even in a small way, to managing their chronic condition.
Interesting. So everything happens online. So even the insurance, how do you manage? I'm sure there's all sorts of KYC validation that needs to happen when I'm onboarding. I can't just open the app and talk to a doctor, I guess.
Absolutely.
You need to run a check on me, etc. How does that work?
So we are a healthcare company as much as we're a digital company. We hold healthcare licenses. We hire doctors. We hire pharmacists. And we offer the same KYC processes that a physical clinic offers, but we offer it digitally. Of course, the world that we're excited about is at-home care. So today we've brought two essential services online to the person using Alma Health. We think there's a wide range of services that we can bring to that person as well to transform their lives. Texting a doctor, requesting lab tests through the app without actually seeing a doctor. There's many examples where we can really transform the life of a person with a chronic condition by bringing all these services that they're used to doing in person at a brick and mortar hospital, bringing them online.
Wow, interesting. And the process of raising capital, and I'm sure there was a lot of insights and stuff that you learned with Careem, and you already kind of knew how this whole game is being played, especially when you talk about scaling. But the process of raising first rounds of funding, did you have like an angel investor or seed funding, or how difficult was it to raise first funds and to get it off the ground?
I was very lucky to get a check from my first angel investor. He actually had a similar idea. He wanted to build this company. When he met with me as well as the team, he was convinced to write us a check as an angel investor. And I don't think the company would be where it is today without that first check from the angel. When they say angel investor, you truly know what that means once you receive that first check. It's an angel from the sky, wow. You know? And truly, I don't think we would be where we are today without his capital and continuous support.
All right. Talking about the ecosystem and UAE, let's say, not going into Middle East. Is there a gap in that phase of startup life, idea stage or very early stage when it comes to funding?
I believe so. I think there's a gap to fund a lot of great ideas. There's a lot of smart people out there with great ideas. And I think there's a gap in investing in great entrepreneurs at the idea stage. I think it would be great for the ecosystem to have more funds dedicated to investing in entrepreneurs at the idea stage, so pre-revenue.
You became part of Hub 71.
Correct.
Right. Tell us more about the ecosystem. I'm curious to know. I didn't have a chance to stop by, but I heard a lot of great things about Hub 71.
Yeah.
Was it to help?
Absolutely. I stepped into Hub 71 a few months before I started the company. I walked into the space and I saw offices occupied by venture capitalists, by Abu Dhabi regulators, by entrepreneurs, and you really rub shoulders with all different stakeholders at that space. So I started off with a desk where I worked and spent a lot of hours. And I'm very lucky that we got into the incentive program as a company and as a team. Now we have an office, we have more space, and we are proud members of the community. And the team loves it. It's a great space.
No, I think it's amazing, and something that we've missed over the previous, let's say, 10 years in UAE and Dubai, both in Dubai and Abu Dhabi, places like Hub 71 or places like the AFC and Gate Avenue, places where startups are together, VCs are together, regulators are together.
Absolutely.
It's accelerating the process significantly, right?
Absolutely.
What do you think?
Absolutely. You know, instead of looking for a VC's email, shooting them an email, waiting for a reply, trying to find the right time to meet, could take days or weeks. You could just go to their office and knock on their door.
That's so awesome.
Or you could meet them at the espresso bar.
That's so awesome.
Yeah, and it happened to us. It happened to us. Our first institutional investor is a VC from London that happened to be at Hub 71. They were the first VC to register at Abu Dhabi Global Markets as a foreign investor. And we were their first check in the region.
Nice.
Yeah.
Wow. If you would be addressing to other future founders who are currently sitting at their desk at the office of a big corporation and thinking about starting, what do you think, or what would be a couple of, let's say, 2 practical advices that you would give them that would be a part of your guidebook to reaching where you are today? Yeah. There's a long way to go, obviously.
Absolutely.
Alma needs to grow, to scale it, etc. There is really a lot of things to do, but you reached a certain stage which is awesome. You have a opportunity now to really make something great and make an impact. What would be some of the practical tips for someone starting to reach the stage where you are at, which is raising funds? You're at the seed or Series A stage now?
Pre-Series A.
Pre-Series A stage. What would that be?
Yeah, lots of, we could spend hours on this topic.
Yes. Is it a too high level question?
It's okay. It's very important. So let me walk you through my own personal experience.
You can also talk, or you can tell us some of the mistakes maybe that you made that would accelerate the process. That you would do better
lots
now.
of mistakes as well. So we can take that question as well. So to your point, Alma Health is an early stage company. I always hear Jeff Bezos or read about Amazon, and it's always the day one mentality, and that strikes a chord with me. Really, to build a company that is customer centric, or a healthcare company that is patient centric, you have to have that mentality, the day one mentality. And at Alma Health, if Amazon it's day one, it's probably less than hour one for Alma Health. So we're still early stage, and that excites me a lot. The opportunity to transform the lives of millions of people with chronic conditions in the region is a huge opportunity. Today we offer virtual consultations, we offer prescription delivery, we started doing at-home care. But the opportunity, especially in the at-home care vertical, is huge, and we can do a lot of work there. So back to our question. My advice to every girl or guy sitting in their office working for a corporate company: learn as much as you can. Learn as much as you can about the industry that you plan on disrupting or operating in. Speak with people from all walks of life that have been touched one way or another by the industry that you plan on operating in. Speak with investors, speak with potential customers, read up on what global players are doing. So invest in learning as much as you can about the industry. The second piece of advice is look for a team that will back you, that will be there for you, will give up their important time to help you execute against this idea that you have. Because at that point, it's all about the team and the masterful execution against the idea that you have.
Interesting. What would be one mistake that you made over the previous 6 months or so? But give me one. Or the one that's the biggest. That if you would go back now, you would do differently, and that would maybe accelerate the process, or you would be in a better place now.
Well, we're a startup. We make a lot of mistakes.
Absolutely.
Take pride.
That's your job.
Exactly. We take pride in learning from those mistakes, which is very important. I think my biggest mistake is hiring a person with the right skill set, but not the right personality, or not a culture fit. And it's a painful mistake as well, because you have somebody on the team that really knows what they're doing, but unfortunately they're not the right culture fit, and affects the morale of the overall team, especially a small team. So I think that's.
How did that happen? You were looking for the wrong things during the interview.
We had a member on the team that really knew how to get the job done, how to get their own job done, but wasn't the right fit.
So what's the future of Alma Healthcare? Where are you looking to be in the next year or so?
We've been live in Abu Dhabi for over 8 months now. We've touched the lives of thousands of people in the Emirate of Abu Dhabi, so Abu Dhabi and Al Ain. And of course, we want to scale quickly to transform the lives of millions of people in the region. We will be launching Saudi very soon. And we want to be in large markets in the region and in other emerging economies as well. I dream of a day where Alma Health is transforming the lives of people in Egypt, in Malaysia, in Thailand, Africa, of course. So we are a small company, but with big dreams.
When do you see that coming?
Saudi, we will be there very soon. And we will be launching another big market in 2022.
All right.
Yeah.
Big announcement.
Stay tuned.
Okay, stay tuned. All right. Let's switch gears now for a bit. We talked about Alma. We talked about business, raising capital and the process. Let's talk more about Khaldoon. You've been around the earth, Middle East, then West. You were studying in Canada. You worked in Silicon Valley. Then you worked back for a VC in Palestine. Then again California events. Then coming here in the region. What was the most difficult part of your life?
So I'm very fortunate to have this life. I don't think a lot of people, especially people from Palestine, have the opportunity to immigrate with their parents, get a...
How old were you when you immigrated?
I was 15. So I'm very fortunate. I'm very lucky. I had a great life in Palestine, had a great life in Canada. And I think the thing that always hurt was being far away from my family and friends. Of course, as a Palestinian, you have a big family, uncles, cousins, aunts, and being far away from my family, watching the family grow and evolve while I'm far away was difficult. And also the friendships that you build, like your first grade friend and your 10th grade friend. Those are the friends that will stay in your memory for the rest of your life. So not being there for their weddings and not being there when they have their first baby or when they lose a family member is painful.
How do you handle that? How do you manage that?
So you got to stay in touch. We live in a day and age where we're all connected on social media. We all have Facebook accounts. So you follow your friends. You know what's going on in their lives. You could send them, a message on Facebook or an email or a message on Instagram. But I don't think it compensates for being there. And every time I go back, every time I visit Palestine, or every time I go back to Canada, because now I live here, I try to connect with family and friends. So I hang out with just like any other normal person. You hang out with your friends and family, you go to restaurants, you go to festivals, pre-pandemic, of course. But yeah, you gotta stay in touch, and you gotta always remember where you came from.
Do you think that sometimes you just get overwhelmed and just too focused on work and you forget about these things?
I don't think so. It's my sweet escape.
Right.
At the end of the day, when you're stressed, calling a friend or calling a relative, calling your mom, calling your brother is what life is about, right?
Yeah. You had a job at one point, and then you decided to go for the MBA studies.
Yeah.
And you told me a story about it and how you came up with that decision.
Oh, I did?
Yeah. So how important and how impactful was higher education for you?
For me personally, it was impactful. I wanted to go to a business school where I mingle with a diverse group of people. At Cambridge, you attend the business school, but you live in a college with different students from different programs. So not necessarily the MBA program that I went to. You get to hang out with students in med school, scientists, physicians, art students, music students, and you actually live with them. You go to the same formal dinners, you go to the same restaurants within the college, and this is what I wanted. I didn't want to go to a pure business school where I'm siloed with other MBA students. I wanted to live the grad school and explore other horizons, explore subjects that I'm interested in. So I used to go regularly with people from the MBA student as well, from the MBA class. We used to go to the union debate. We attended different formals at different colleges. I got to meet Stephen Hawking.
Wow.
Yeah. So
tell us about that experience.
It was an unforgettable experience. It was an unforgettable experience. I'm sure you know he's a great man, and went through a lot in life, but continued to pursue his dream, his passion, and nothing stopped in his way. So really, when he came into the room that we were in, and it was a big room, it was a formal dinner with hundreds of students. When he came into the room, you just feel his presence. You feel a strong presence in the room, and you have to turn your neck and look. So it was a really fascinating experience, and he has an awesome sense of humor as well. So he has a lot of presence, a great sense of humor, and a really inspiring guy. And losing him was a loss for the university and the entire world.
Wow. Did you had any, or have at the moment, people who influenced you, who mentored you, or can you point out someone who had the biggest influence on you?
Yeah. Lots of mentors. I have friends who are mentors. I have colleagues from Careem, from Nokia, that are mentors, professors at Cambridge that are mentors, team members that we have at Alma Health who really know their domain are mentors to me as well, investors, board members. So I don't have per se one mentors. I like to hang out with people who are smarter than me and learn, just constantly learn.
Interesting. They say don't be the smartest one in the room. You're not really going to evolve a lot.
Yeah, you don't want to be the smartest person in the room. You want to be the curious kind. You want to be asking a lot of questions, the right questions, and learning. That's the best way to learn.
So Elon Musk once pointed out that the best advice he was given is constantly think about how you could be doing things better and question yourself. Is there an advice that you received that you can point out now, and who gave it to you?
I was spending time with our first angel investor this morning, and as I mentioned, we're very lucky to have him, and he told me ownership is the most important value you could have within your team. So this is a value that you really want to embed into your culture. And this happened this morning. Yeah. So culture,
fresh.
It's fresh advice. So ownership is very important. And that could mean many things, by the way. It means treating people that work in the company like it's their own company, giving them the space to experiment and a safe space to fail, listening to what they say and take their suggestions and insights seriously. So I think if you want to grow and scale a company rapidly, hire a great team and give them a strong sense of ownership.
I agree 100%. What's the kind of team structure in your company? Do you have a hierarchy, or it's kind of flat, or how do you manage that?
Yeah, so of course we have an open door policy. We're still a startup, and even as the company gets bigger, inshallah, we'll always have that. And this is something I learned from different environments that I worked in. It's very important to be approachable, be humble, and encourage people to have tough conversations.
Be humble. I like that. That's one of the principles or things that I really appreciate and respect in life. Why do you think being humble is important?
Humble is important to me because life is short. At the end of the day, people will remember how you treated them. How did they perceive you, right? No one cares how much money you have in the bank. No one cares what assets you own. People will always remember how you made them feel. And I think being humble pretty much means leaving a positive impact on people at every interaction. It's important to be humble.
100%. Ray Dalio wrote a book, Principles.
Yeah.
Maybe you read it, maybe not.
I have not.
You should read it. It's a good book. And he is explaining his life and business professional principles that he is following. Some of them are radical transparency, for example. Do you have any of your own? It can be like just life principle or business principle. Be humble is one, obviously.
Obviously, yeah.
What would be other principles that you're following that are really impactful or important for you in life and in business?
Life or business, I think transparency is extremely important. And that means having tough conversations sometimes with people that you work with, the corporate board that you report to, your family members. So you have to be transparent, and you have to let people know what are you capable of and what are you not capable of. What are the things that you could influence and what are the things that you can't influence. So transparency is very important. The second one is being positive. I'm a naturally optimistic person. Being positive helps me remain persistent, remain patient, and I just like to be the positive person in the room.
What do you do? I mean, I don't believe that you can be always super positive.
Of course
try
not.
to be.
Of course
what
not.
do you do when it's really difficult? It gets you down. You're feeling low. What do you do to get yourself up and just straighten up?
Just seeing the cup half full, right? There's always a positive angle to a situation that you're in. I've personally failed a lot, and I take and I'm transparent about that. And I take pride in the lessons I've learned from these failures. And I've also learned that there's always a positive angle to a depressing situation or a negative situation. And I don't know how old you are. I'm 35.
30.
Yeah. And I've been, like many people, like all people, I've been in great situations and I've been in terrible situations. I've seen family members pass away. I've seen new family members being born. This is life. You have to be positive.
No, absolutely.
Yeah.
You said you failed a lot of times. You learned a lot of lessons. What is the favorite failure of yours?
That's a good question. Wow.
All right. You can give it a thought. We can.
I don't
continue.
know if I have a favorite.
So there is this global movement there called How I Fucked Up. You heard about them. So they're throwing this event. We're bringing people talking about their failures, things that happen in life. You can say that I failed. I made a mistake. I started a business which miserably went down. But that taught me a lesson that set me up for a later success in life. Like, is there an episode in life that happened at the time? It could be called a failure.
Absolutely.
That later on set you up or taught you a lesson. And set you up for later success.
It's a great question. You should ask all your guests.
I'm asking.
I hope you don't use it on dates, though. So after I finished my MBA, I wanted to start a company. And I essentially wanted to start the BuzzFeed of the Middle East. I don't know if you're familiar with BuzzFeed, but it's like light-hearted content where you summarize essentially the news and you quote-unquote represent it in a way digestible by the millennials. So I really wanted to start a company in that space, but I failed. I couldn't get any. I couldn't get any co-founders to join me. I couldn't hire a team. I quickly understood the fundamentals of the business, and it's not the best business that you want to be in. So that was a fail fast situation.
What changed from that point till many years later when you founded Alma? You did manage to gather the team. You managed to start a company. You managed to raise funds. What changed?
So the vision, simplifying or transforming the lives of people with chronic conditions, struck a chord with my co-founder, struck a chord with my first angel investor. And as I mentioned earlier, he was actually thinking about starting that business himself. Healthcare is a massive industry, and the opportunity to disrupt this industry is massive as well, and it's an industry with strong fundamentals, and this is the kind of business that I want to start. This is the kind of industry that the team and I want to disrupt.
We'll be following.
Sorry?
We'll be following your progress.
Inshallah.
As the change officer, if there was one thing that you could change in the Middle East, what would that be?
Healthcare. Absolutely healthcare. Unfortunately, the region suffers from high prevalence rates of chronic conditions. And I think the millions of people who have chronic conditions have an inconvenient healthcare experience. And at Alma Health, we're on a mission to transform that experience. I see a future where healthcare is accessible, it's easy, and it's convenient, and as convenient as ordering a Careem or ordering lunch from Talabat. This is the future of healthcare that we strongly believe in, and my co-founder Tariq and I, as well as the entire team, are on a mission to change that.
Good luck.
Thank you so much.
All right, so I have a couple of fun questions before we wrap up. Here they are. If Khaldoon was an animal, what animal would he be?
I would be an elephant.
Elephant?
Yeah.
Why elephant?
Elephants are family oriented.
All right.
Elephants are protective of their tribe. They're great animals. Yeah.
They are great in every...
And they're very cute.
Awesome.
Yeah.
If Khaldoon was a car brand, what car brand would he be?
That's a good question. I would like to be a Mercedes.
Why Mercedes?
Mercedes machines are reliable. They're luxury, but not super luxury. Yeah, I'd love to be a Mercedes.
And if you could have a superpower, what superpower would that be?
I've always liked Batman. And I liked Batman because he was a real person. You know, he was a human being. He couldn't fly. He couldn't shoot spider webs out of his hands. But he was a person that was able to take a very sad event in his life and rise above it and have a positive impact off people's lives. And I think that's a superpower.
Inspiring indeed.
Yeah.
I agree.
Yeah.
Thanks for coming, Khaldoon.
Thank you so much for having me, Vuk.
It was really amazing
It's
and
a pleasure.
inspiring.
Absolutely. Thank you.
I hope that you enjoyed this great episode with Khaldoon and that he managed to inspire you. He shared some really insightful tips with you, and this is going to push you to go for it because there is no reasons not to. If you like what we're doing here with the Change Officer podcast, please like and subscribe and stay tuned. There is another episode coming out next Monday. Thanks, everyone.